Thank you so much for joining us. Welcome to our presentation on heart attack versus cardiac arrest. What happens and what to do. Today we'll learn about the importance of physical activity for heart health. My name is Idlanda Lopez, and I am the Community Impact Manager at the American Heart Association in Los Angeles. I am excited to be hosting this live virtual health lesson. I'd like to thank Providence for supporting our work to improve blood pressure control and overall health in Southern California. A couple of housekeeping notes. Because we are in a Zoom virtual setting, we'll be using the chat feature as well as the Zoom poll function to interact with one another. So please feel free to type your questions and comments in the chat. Before we begin, if you haven't already, please share in the chat which city you are in. Today's presentation is for educational purposes only. We do not offer any medical advice. We can provide resources, but specific questions on a diagnosis, medication, and treatment should be directed to a doctor. If there are any questions asked in the chat that are specific medical nature, we will have a qualified medical professional follow up with you with your answer to answer them. You can also visit www.heart.org for tools, resources, and information about how to stay healthy during this time. We want to learn more about your knowledge, and we'll start by taking two poll questions now and another poll near the end of the class. So let's get started. First question is cardiac arrest is an electrical problem. True or false? We have about 50% participation. I know we can definitely get our numbers higher. Thank you to everyone that answered. I will share the answer to the first question with you shortly. Now, with the second question, in the last month, on average, how often have you aimed for at least 150 minutes a week of moderate intensity aerobic activity? 0 times per week, 1 to 2 times per week, 3 to 4 times per week, or 5 to 7 times per week? Thank you to everyone that has answered. Today, we focus our attention on two life-threatening events, heart attack and cardiac arrest, each with its unique characteristics, implications, and urgent response requirements. So let's discuss the myths about heart attack. Some of the phrases that are common is, I'll know when I'm having a heart attack because I'll have chest pain. Heart disease runs in my family, so there's nothing I can do to prevent it. My heart is beating really fast. I must be having a heart attack. So let's discuss the first one. I know when I'm having a heart attack because I'll have chest pain. Not necessarily. Although it's common to have chest pain or discomfort, a heart attack may cause subtle symptoms. These include shortness of breath, nausea, feeling lightheaded, pain or discomfort in one or both arms, your jaw, your neck, or your back. Even if you're not sure it's a heart attack, call 911 immediately. Discuss the other one. Heart disease runs in my family, so there's nothing I can do to prevent it. Although people with a family history of heart disease are at higher risk, you can still take steps to dramatically reduce your risk. Create an action plan to keep your heart healthy by tackling those to-dos. Get active, control your cholesterol, eating better, managing your blood pressure, maintaining a healthy weight, control your blood sugar, and stop smoking. And one of the last ones, my heart is beating really fast. I must be having a heart attack. Some variation in your heart rate is normal. Your heart rate speeds up during exercise or when you get excited and slows down when you are sleeping. Most of the time, a change in your heart beat is nothing to worry about. But sometimes it can be a sign of an abnormal or irregular heartbeat. Most arrhythmias are harmless. Some can last long enough to impact how well the heart works and require a treatment. So, therefore, we all need to be proactive in our awareness of a heart health. So, what is a heart attack? A heart attack is a circulation problem. A heart attack occurs when blood flow to the heart is blocked. A blocked artery prevents oxygen-rich blood from reaching a section of the heart. If that blocked artery is not reopened quickly, the part of the heart normally nourished by the artery begins to die. A heart attack strikes someone about every 40 seconds. This happens because arteries that supply the heart with blood can slowly narrow from a buildup of fat, cholesterol, and other substances. And the amount of damage to your heart muscle depends on the size of the area supplied by the blocked artery and the time between injury and treatment. The blocked artery should be opened as soon as possible to reduce heart damage. So let's discuss what happens. During a heart attack, symptoms of a heart attack may be immediate and may include intense discomfort in the chest or other areas of the upper body, shortness of breath, cold sweats, and or nausea and vomiting. More often, those symptoms start slowly and persist for hours, days, or weeks before a heart attack. Unlike with cardiac arrest, the heart usually does not stop during a heart attack. So the longer the person goes without treatment, the greater the damage. You should know the warning signs of a heart attack so you can get help right away for yourself, your loved ones, and any person that you interact with. For example, pain or discomfort in one or both arms, your back, neck, jaw, or stomach are symptoms alongside the earlier ones we discussed. Symptoms vary between men and women. Well, let's discuss how those symptoms in men are different than in women. So, for example, the symptoms in men are uncomfortable pressure, squeezing fullness, or pain in the center of your chest. It lasts more than a few minutes or goes away and comes back. Pain, discomfort in one or both arms, the back, neck, jaw or stomach, as we discussed earlier, and the signs of breaking in a cold sweat or nausea or lightheadedness. And let's discuss the symptoms in women. Women's most common heart attack symptom is chest pain or discomfort. They may experience symptoms that are typically less associated with heart attacks, such as shortness of breath, nausea, vomiting, and back or jaw pain. However, even when signs are subtle, the consequences can be deadly, especially if the person doesn't get help right away. So let's discuss how understanding your risks to prevent a heart attack can not only save your life, but your loved ones. And the risk factors and traditional risk factors are essential to our daily lives. So some of the risk factors is including your age, your sex, if you have diabetes, high blood pressure, high cholesterol, or are overweight or obese, and if you smoke. In other words, knowledge is power. If you understand the risk for heart attack, you can take steps to improve your health. Risk factors, as discussed, are traits and lifestyle habits that can increase your chance of having a heart attack. So it's important to know them. You can change some risk factors and some you can't. However, the first step is to talk to your healthcare professional who can help you reduce, control, or prevent some of these risks. They may recommend healthier choices, changes to your daily habits, prescribe medication, or both. If you don't have a primary care physician, you may be able to see someone at a clinic in your community. Your healthcare team will review your medical and family history. They also want to know whether you've ever had a heart attack or stroke or blockage in the arteries of your heart, necks, or legs. So let's discuss a little bit about your lifestyle. They will ask about your diet, physical activity levels, alcohol intake, drugs, or supplements you've been taking. Cardiac arrest is a leading cause of death. Let's discuss a little bit about the data behind that. So cardiac arrest affects thousands of people annually, with about 75% of them occurring in your personal home. So the causes of cardiac arrest is the scarring of the heart tissue, thickening heart muscle, electrical abnormalities, blood vessels abnormalities, and recreational drug use. So the scarring of the heart tissue, it may be the result of a prior heart attack or another cause. A heart that is scarred or enlarged from any cause is prone to develop life-threatening arrhythmias. The first 6 months of a heart attack is a high risk period for sudden cardiac arrest in patients with heart disease. And for thickening heart muscles, damage to the heart can be the result of high blood pressure, heart valve disease, or other causes. A diseased heart muscle can make you prone to sudden cardiac arrest, especially if you also have heart failure. Heart medications. Under certain conditions, some heart medications can set the stage for arrhythmias that can cause sudden cardiac arrest. This is called a paralytic effect. Significant changes in blood levels of potassium and magnesium can also cause life-threatening arrhythmias and cardiac arrest. So electric abnormalities may cause sudden cardiac arrest in children and young people, including the long QT syndrome and Wolff-Parkinson-White syndrome. Recreational drug use. This can occur in otherwise healthy people. And let's discuss a little bit about what is cardiac arrest. So cardiac arrest is an electrical problem. I'll repeat that again for the importance of that phrase. Cardiac arrest is an electrical problem. It occurs when the heart malfunctions and stops beating unexpectedly. Cardiac arrest is triggered by an electrical malfunction in the heart that causes an irregular heartbeat. With its pumping action distributed, and the heart cannot pump blood to the brain, legs, and other organs. So what happens? And the importance of knowing what happens can not just save your lives, but your loved ones. So during a cardiac arrest, seconds later, a person becomes unresponsive and is not breathing or is only gasping. And death occurs quickly if the person does not receive immediate CPR. So once a person goes into a cardiac arrest, you need to start chest compressions immediately. So what to do when there's cardiac arrest? Don't hesitate to call 911. Start hands-only CPR. Use an AED if available. Even if you're not sure if it's a heart attack, call your local emergency number. Every minute matters. So what is the link? Most heart attacks do not lead to a cardiac arrest, but when cardiac arrest occurs, heart attack is a common cause. Other conditions may also distribute the heart's rhythm and to and lead to cardiac arrest. So let's discuss learning CPR and how to save a life. And why learning hands-only CPR is important. According to the American Heart Association, about 90% of people who suffer out of hospital cardiac arrests die. When a person has a cardiac arrest, survival depends on immediately receiving CPR from someone nearby. Now, you may ask yourself, what is CPR? And CPR is an emergency life-saving procedure performed when the heart stops beating. CPR can double or triple chances of survival after cardiac arrest. So my question to you is, have you ever done or seen someone do CPR before? And if you have, please share in the chat. Now, the 2 steps to save a life. The first step is to call 911. If you see someone unexpectedly collapse, please do not hesitate. The second step is push hard and fast in the center of the chest. Now, when you're pushing hard and fast in the center of the chest, what has helped me and has helped others is beating to a familiar song that has 100 to 120 beats per minute. Now, the American Heart Association encourages using songs like Staying Alive, Crazy in Love by Beyonce, or Hips Don't Lie by Shakira. Now, these songs have proper compression rates, and people feel more confident performing hands-only CPR and are more likely to remember and correct the correct rate when trained to the beat of a familiar song. So perhaps you're not familiar with these certain songs. We can also share a link with other songs that have the proper compression rates for you to be able to be familiarized. Let's take our pulse check pull again. So the first question is, cardiac arrest is an electrical problem, true or false? We're almost there to 100% participation. I know we can get there. We'll just give a little bit more time. I will share the results. 90% of you said true, and 10% of you said false, and 90% of you are correct. It is true. Now, I will share the second one. Our second question to all of you is, will you commit to scheduling an appointment with your healthcare professional to learn your risk for heart disease? Let me launch it again. I will try one more time. There we go. So sorry for the technical difficulties. Will you commit to scheduling an appointment with your healthcare professional to learn your risk for heart disease? And we have almost about 50% participation. We have about 75. I know we can get to 100, I believe, in this participant class. Give it one more minute. Thank you all who participated. More than 80% of you have voted yes, that you will commit to scheduling an appointment with your healthcare professional to learn your risk for heart disease. Thank you for everyone that has participated. Our call to action. Our call to action today is to take care of yourself. And we can do that by scheduling an appointment with your healthcare professional. Now, in this appointment, we can also discuss the importance of our risk factors, our family history, and changes that we can do to improve our heart health. Now, let's aim for at least 150 minutes a week of moderate to intense aerobic activity, such as brisk walking, 75 minutes of rigorous aerobic activity, such as jogging, or a combination of both, preferably spread throughout the week. Now, with physical activity, I feel that we can get creative on how we tie that to our daily lives. Some tips that have worked for me is setting a calendar hold to be able to take a walk, taking a walk with my family members, having the discussion the elements that we discussed today with our family members, and tying in physical activity. Now, modifying your family's diet if needed. We'll also share in this link with healthy cooking tips about making smart substitutions, healthy snacking ideas, and to better prepare methods for you and your loved ones. Thank you for your participation. I want to thank the American Heart Association team working behind the scenes who helped coordinate this program. And a special thank you again to Providence, our local supporter in the important hypertension initiative in Southern California. Additionally, I'd like to invite you to our next virtual health lesson on February 13th at 12 p.m. There's a link to register in the chat. and we'll send out the registration link via email. We hope to see you on our social support circle next week. We will be sending a follow email with the link to register, and we appreciate your feedback about today's health topic. Please take a minute to complete a short survey that will appear when you close out the screen. Thank you so much and have a great day.